Hello, I'm Dr. Kovar. I'm the Medical Director for the Harris County ESD-11 EMS. This week we have a special request from Wunsche High School, Ms. Groot's class, EMT class. Take it away.
Hi, I'm Mrs. Groot with the Wunsche High EMT class, and we have a question for Dr. K.
Hey Dr. K, how do we know if we have a concussion?
March is Traumatic Brain Injury Awareness Month. We're going to talk a little bit about head injuries. Particularly the question was, hey Dr. K, how can I tell if I've had a concussion? Well, the traumatic brain injury spectrum goes from mild symptoms, like a headache, all the way up to severe changes in alertness, seizures, and even death. Concussions account for probably 80 to 90% of the traumatic brain injuries that we see. The brain is protected inside the skull. The brain is actually suspended inside the skull, inside the spinal fluid, and any sudden impact, any sudden change in direction, any shear forces can impact that brain tissue. When there's a significant head injury, what can happen are changes in neurologic function. What you might experience, obviously, is initially a pain and a headache. Symptoms of a concussion can be just a change in your mental status, can be a little confused, not quite aware where you're at, a little dazed. You may have some nausea, you may actually vomit. Headaches are common, but again, they should be relatively short-lived and easily controlled with over-the-counter medications. Changes in your memory, even depression and personality changes can be seen after a head injury. What should I do if I'm concerned that I might have had a concussion? Well, you need to seek out medical advice. You need to seek medical care. Obviously, contacting EMS is a great way to do that because we have qualified people that can come out and take care of you. One of the things that's very important, if you're worried about any changes that you might have in your alertness, your awakeness, your ability to coordinate, you probably shouldn't drive yourself up to the hospital. When you call EMS or they arrive and take you to the hospital, what should you expect? Well, you should be evaluated by medical professionals that can do a series of tests to take a look at exactly what kind of injury you had and what the severity may be. So those tests, again, are going to range from basic memory tests, giving somebody a series of numbers or events to remember and then repeat back. Test of eye function, pupil reaction, abilities for the eyes to focus, ability to stand, walk, almost like a drunk test that you'd see in the field, because that could be an indication of a significant intracranial problem. When you have a head injury, the brain can be jolted, the brain can be injured. That injury will cause anything from minor short-circuiting to bruising, to contusion, to bleeding, to swelling, to severe injuries. So the symptoms, again, can go from very mild local pain to just not feeling right. What people used to refer to as, I got my bell rung. I'm just not quite clear. I'm a little bit confused. One of the things that can happen is abnormal movement or a loss of consciousness, even seizures. A lot of these seizures are just the brain's initial response to that injury. Most of those will resolve without any need for further treatment, and the medical professionals will evaluate you to give you an idea whether this is going to be an ongoing problem or not. So what if your family member, your child, has a head injury and doesn't act normally, or maybe had a brief loss of consciousness, or even had something that looked possibly like a little abnormal movement, shaking, jerking, or even a seizure? Those injuries need to be looked at immediately. You need to contact EMS, go to the hospital, and then be checked out. The evaluation that you're going to receive there is going to follow certain guidelines. And again, the medical professionals will evaluate you, do the tests that we've talked about, and make some decisions whether further testing or imaging is needed. So CAT scans are a normal test that's available in the emergency department. The indications for CAT scans will be determined by your medical professional. He'll perform the exam we talked about and talk to you about the symptoms that you have. There are guidelines for when those are necessary and when they can be delayed. On a spectrum of injuries, head injuries, and traumatic brain injuries, concussion is the mildest form and the most common form. After the testing is done, after a CAT scan, if indicated, is done and is normal, you will go into an evaluation period for that concussion. What that really is about a 24-hour period of repetitive evaluations and progressive activity to see if those symptoms recur or not. So a head injury is commonly associated with pain. The pain should be reasonable and relatively brief, controlled with over-the-counter medications such as Tylenol, Motrin, etc. Pain that persists, or any of the other symptoms we've talked about, personality changes, agitation, nausea, general fuzziness, memory problems, etc. Again, in the absence of any evidence of bleeding or swelling on the evaluation, is a concussion. Now, you'll go into a period of evaluation for the concussion, which again will last depending on the duration of your symptoms. Repetitive injury, the reason we pull kids and adults out of the sports or the work environment is that repetitive injuries, recurrent trauma without having complete recovery is going to be additive and can protract the symptoms for a long period of time. So contact sports are a common way to get a head injury and a common way that concussions can develop. What you'll see is a sideline evaluation by the coaches, by the support team there, to look for the signs of confusion, coordination, mental fog, and they're going to take people out of play to make sure that those symptoms resolve completely before any further activity is allowed. What can EMS do for you if you are concerned about a significant head injury or that you may have had a concussion? As part of the medical team, we're aware of the resources in the area. We can evaluate you, look for other injuries. We can begin treatments and therapies for pain, for nausea. We can watch and monitor your symptoms and report them to the medical professionals and get you to the most appropriate place for your needs. So the danger of discounting or ignoring a head injury that produces change in your mental status, brain fog, confusion, amnesia, balance problems, nausea, memory, and personality changes is that these effects can be additive if not appropriately treated. There's a syndrome called post-concussive syndrome. Post-concussive syndrome results from the inadequate treatment and resolution of previous symptoms. It comes with repetitive injury without resolution of the previous injury and can be protracted for months and longer. Persistent problems with personality changes, with memory problems, with depression, with headaches are common with a post-concussive syndrome. So you need to contact medical professionals. Harris County ESD 11 EMS is here for you to make those connections, to do the initial evaluations, to begin treatments, to help you with your pain, help you with the nausea, and get you to the right medical professionals for this care. So if you have a question that you'd like us to address on Hey Dr. K, contact the number below and we'll get right back with you and see what we can do to help you out. For the Harris County ESD 11 EMS, I'm Dr. J. Kovar.